Good afternoon, guys. I have discussion B for you. We're discussing navigating Alzheimer's disease. Here we go with the presentation I made for you. Please sit back and enjoy. The article argues that navigating Alzheimer's disease feels like steering into unpredictable waters, overwhelming for families, costly for communities, and urgently in need of stronger caregiver support. What the op what the opi- what the opinion piece is saying. The Watcha Eagle community uses a vivid metaphor. Caring for someone with Alzheimer's is like taking a small boat into open waters only to face sudden storms. Families often enter this journey without preparation. Training or a clear map. The emotional, physical, and logistical demands escalate quickly, leaving caregivers exhausted and isolated. Why the challenge is growing. The author highlights the demographic and economic pressures intensifying the crisis. The U.S. population over 65 is projected to rise from 58 million in 2022 to 82 million by 2050, increasing the number of people at risk for dementia. In Kansas alone, 55,000 seniors live with Alzheimer's. About 11.2% of the state's older population, roughly 90,000 Kansas Kansas Kansasans are unpaid caregivers, meaning juggle jobs, children, and 24/7 responsibilities. Medicaid spending on Alzheimer's care in Kansas uh, reaches 589 million, underscoring the broader economic burden. These numbers reinforce that Alzheimer's isn't just a personal tragedy, it's a community wide challenge. The caregiver reality. Caregivers often step into a role suddenly without training or guidance. The article emphasizes consistent fatigue and emotional strain, safety concerns, around and around the clock vigilance. The sense of being unprepared for the disease is unpredictable progression. The piece argues that caregivers shouldn't have to navigate this alone. What helps families stay afloat? The author calls for a stronger support infrastructure, comparing it to navigational tools for sailors, education and community resources to help families understand the disease and plan ahead. Respite care to prevent burnout, increased federal funding for caregiver support programs through the Administration for Community Living. Better access to guidance so families know where to turn before they reach crisis points. These supports act like charts, lighthouses, and experienced crew members, tools that make the journey survivable. Why this matters for your work. This piece aligns closely with your focus on family-centered frameworks, caregiver education, and myth busting. It reinforces the message you often elevate. Caregivers are doing complex skilled labor without adequate structural supports. The article's metaphors and data could be powerful material for your podcast. Here's a clear, grounded explanation of the text you highlighted, based entirely on the surrounding page content from the Lancet Neurology. What the text is saying in plain contextual terms. The article is framing Alzheimer's disease as a rapidly growing global challenge driven by aging populations. It opens with a shrinking projection. In the US alone, the number of people living with Alzheimer's is expected to rise from 5 million to more than 13 million within a decade. The surge is used to underscore a central point. Healthcare systems are not prepared for the scale of need that is coming. Because of that, the author argues that two priorities become urgent: improving how we care for people living with Alzheimer's today, and improving how we support the caregivers who shoulder the most of the daily work. Why the book being discussed matters. The article then introduces The Future of Alzheimer's by Shannon Ricciardi, a senior care professional with 30 years of experience. The book is positioned as a kind of expert round table. in print, where 20 leading scientists, clinicians, and specialists respond to deceptively simple but emotionally loaded questions. What advice can we offer for those who cannot wait for a cure? This centers the reality that millions of families need help now, not in a hypothetical future. 2. Do you think there will be a cure? And if so, when? This invites experts to speak candidly about scientific progress, timelines, and realistic expectations. The article's framing suggests that the book is less about predicting breakthroughs and more about providing grounded hope, practical wisdom, and a roadmap for navigating the present. The deeper message the article is signaling. Even in this short excerpt, the editorial tone is clear. Alzheimer's is not just biomedical problem, it's societal one. Care infrastructure must evolve because the number of families affected will grow dramatically. Expert insight is valuable, but only if it translates into actionable guidance. For people living with the disease today, hope is important, but it must be paired with realism and preparation. In other words, the roads ahead are both scientific and human. Better treatments, yes, but also better systems, better support, and better understanding. Okay, guys, that is B for you. I will see everybody after dinner for show. Until then, Gator Wellness. Take care, folks.